Yep, that is the
Okay, Jackie Reimer, what are the recent success rates with FSM in children with autism? Child is nonverbal. We talk about that in the core and more in the advanced. The success rates are good. There's a video on our website from Steve the dad. His son was 19 when he married the boy's mother. By the time he was 22, the kid hadn't improved much. And they had about 50% improvement in 9 months. It was pretty awesome. Usually we use the concussion protocol. First timer to FSM, listening to your video in the last 2 weeks, be able to connect the dots for me after 8 years. You're welcome, Beth. It's what we do. I was rear-ended, fully stopped. Oh, dear God. Head turned to the left, frontal headache, head, face. We can fix that. Pressure in the head. Yeah, now with vertigo, you have an inner ear disorder. You need to find an ENT or a neuro, what do you call them? Neuroendocrine specialist, and get checked for vestibular injury. You also need to have AP and lateral and APOM side bending. APOM side bending x-rays. We'll talk about that in the core seminar. There's a whole segment on what you have. It's fixable. It's not easy, but it's doable. Oh, geez. Should I run concussion protocol and a chronic degenerative disc protocol? Wait, who's that? Is that Beth? No. Why are laymen not allowed to buy an FSM? I'd love to buy one. I know, isn't that terrible? It's not my fault. Blame it on the FDA. It's a prescription device. People that sell microcurrent devices to patients are breaking the law, and I don't do that. It's how I've stayed in business and survived several FDA audits, so we just don't go there. Sorry. Okay, why is that not moving? Beth, come on. I can't bring it up over on the other screen, and I can't get this.
And you can't use the.
Well, the little, oh, this is why Kevin is the key to doing this. But you can find, anonymous, you can find an FSM practitioner and have prescribed a custom care. You can take the course. But you shouldn't. Beth, yes, run the concussion protocol. It's not a degenerative disc. The vertigo is probably not a cerebellum medulla problem. It's an inner ear problem, and it's the upper cervical ligaments. So in our protocol, if you have a FSM unit, you'd run neck pain, ligamentous instability, and the concussion protocol. Super hypersensitive. Patient with multiple chronic stealth infections. Well, start with the neurovisceral course. The stealth infections are not the problem. They seem to be the problem, but it's your immune system, and that comes back to the vagus nerve. Because we can fix the vagus, we can usually intersect with all that stuff. We can usually intersect with and improve the response and reduce the damage from the stealth infections. Sometimes the stealth infections are not the problem, they're a symptom. Primary interest, channel A, FSM frequencies. Yeah, you can't do that. Peterson, H, whoever you are, utilize channel A FSM frequencies to affect the amygdala, hippocampus, and the thalamus. Yeah, the problem with it, you have to take the neurovisceral module. I think we sell that on the website as a download, right? As an MP4. And you can't do just channel A. You have to do something to the amygdala, the hippocampus, and the thalamus, and that's usually to reduce the activity of. If you just resonate with the tissues, you're just as likely to increase their activity as to quiet them. And what we do in PTSD and vagal dysfunction and limbic system dysfunction is extraordinary. I think we have, do we have the consciousness presentation from Time Waver? Do we have that on the website for
Probably.
the brain? I think it might be practitioner.
Yes.
Is
It's
that
definitely there. Okay.
okay? Is it for practitioners or is it open to the public?
It's open to the public.
Open to the public. Yeah. So on our website, there is a presentation I did for Time Waver on consciousness, the brain, and frequency response. Is there a dentist that is proficient in using, oh man, okay. Vera, I hate to tell you, but when it comes to infectious disease, especially bone infections and dental infections, I believe in chemical warfare and surgery. FSM is not to be used for chronic dental infections. And you're talking to somebody that's had 9 dental surgeries. I had multiple root canals. The chronic dental infection was completely asymptomatic. It was only a 3D cone beam that told me that I had it. And yeah, it's where my heart disease came from. It's why I needed my hips replaced. You need to find a dentist that knows how to take out the teeth and clear up the infection in the bone. You need to find somebody that will take out the teeth, put in the bone grafts, use ozone or something to kill the infection in the bone. And then you need to live without those teeth for about 9 to 12 months until the bone grafts heal. And then you can get your implants. Do not, if you have chronic dental infections, do not go to a dentist that says, I'll take out the teeth and put in the implants at the same time. Don't even go there. So I think I tell that story someplace during a core seminar, but yeah, no. And then you find an FSM practitioner who will treat you with one of the post-operative protocols that I use for post-dental infection surgeries. So I had 9 jaw surgeries to remove infected teeth and put in implants, and I had absolutely no bruising and no pain. I'm just telling you. Is FSM effective, Sunil? Effective in autoimmune disease? Yes. Spondylitis, sacroiliac, yep, absolutely. And the way you treat autoimmune conditions is to get the vagus turned on, because in order to have an autoimmune disease, you have to have your vagus turned off from something. So there is a thing that is causing your autoimmune disease. It is usually infection. Often, if you're living in New Delhi, it's going to be mold or parasites. Absolutely guaranteed. I mean, I'd take you to lunch if I could get to New Delhi, which I can't. But you get rid of the cause by treating either the mold or taking an anti-parasite medication, and get rid of the cause, and then treat the vagus, the limbic system. The affected joint is easy. But yeah, we can do that. We talk about it all the same. How do I feel about the Healy that's come out? Well, the Healy has complicated my life a little bit because everybody thinks the Healy does FSM. It's a single channel unit. It's associated with Time Waver, the company that I'm working with in Germany. It's a nifty little device that uses frequencies from Nina, but it's single channel. And because it's come out as a multi-level marketing network system, and multi-level marketing people are hard to control when it comes to making claims and understanding the regulatory requirements when you have a device, that's complicated my life a little bit. So the Mac Healy, which was our device that Healy was supposed to bring out, we've had to take it out of the Healy network system, and Time Waver is going to release that separately. It can't be called the McHealy. I don't know what it's going to be, but there are people that are getting great results with the Healy, so I can't say anything bad about it. But you need to know that the Healy is not FSM. Can it be used to prevent or treat coronavirus? Wow. Okay, that is a very dangerous question these days, because the FDA frowns seriously on anybody that says they can prevent or treat coronavirus. But when I got back from England, I did some research, and we developed like what he called it, what did I call it? The flu respiratory protocol. And the preliminary one was released in a webinar in March 19th, and then the second one was a week later, and we added organ systems to it, I think, and the brain. And the reports from the field from our practitioners who have that protocol have been universally successful. People with serious symptoms who were told to wait at home until they got worse, but who were pretty certain they were going into the hospital, treated themselves with it, and didn't end up in the hospital. Do I do virtual consultations for patients that have FSM device and need more guidance? If you are a patient and you have an FSM device, you need to go to the practitioner that prescribed that device. I can talk to the practitioner. I cannot talk to patients because basically it's illegal. I have never seen you. I've never examined you. I don't have your history. I can't order any more tests. So you can go to your FSM practitioner if you have a specific problem with the device or a specific condition that you do not feel that they are treating successfully. You can ask them to email me, and I will consult with them. You have to know that I had eyelid surgery about 2 weeks ago, and I'm about 2.5 weeks behind on emails, so it might take me. Somebody, do you have some tips and tricks for a civilian retired engineer who took the 5-day course, excited about FSM, love the textbook on pain management, the resonant effects, read it 3 times before the course? Who is this? Madeline, how are you? Yeah, you can use anything you want. If it conducts current, you can use it. How effective is microcurrent for clearing vision after surgery for detached retina? So here's the thing with the eye. In LASIK surgery for the cornea, in cataract surgery, and I'm assuming I would have the same advice for detached retina, their expectations for healing are based on a standard rate of healing. So we basically double the rate of healing. So in 2 weeks after my eyelid surgery, which is why I'm not on video right now, 2 weeks after eyelid surgery, I am where they expect me to be at 4 weeks, and at 3 weeks, I will be where they expect me to be at 6 weeks. So what I would use for you is the concussion, Donald Parker. What I would use for you is the concussion protocol, perhaps reducing general inflammation and emotional relax and balance. That would probably help. You don't want to turn the vagus on, so you leave the concussion and vagus alone. Would this knowledge apply or transfer to Healy units or not? No, it doesn't. Healy's single channel, it uses Nuno-Nina frequencies. The device selects what frequencies it's going to run. You don't. And my practitioners have to know what they're doing, and the frequencies are very specific, and they do exactly what you tell them to do and nothing else. And yeah, so use the Healy for what it's good for, but it's not good for FSM. Cost of training from a practitioner perspective. Business side is, you don't even want to think about it. So the training, I think we have it as $995 for module 1, half price from if you get module 2. The devices, the custom care is $2,100, $2,200, $2,300 with the software. And then the precision care is about $6,500. The thing that happens from the business side is that you have to be prepared for practice growth. You take some time to learn how to integrate it into the practice, and I don't have a webinar on that yet, but we're going to do one. You have to, if you're a medical physician, you have an assistant that does it. You don't have time. So you have an assistant that you train as well as yourself. You hand them a protocol, you tell them what to run. you go on and see somebody else, and you see somebody else, and you go back into that room, make sure everything's okay, sign off on the chart notes, go back in the next room. I kept 4 rooms full, 3 rooms full, 8, 10 hours a day. Most people, their practice increases, probably doubles within a year. We have a practitioner, find a practitioner on our website that is free for the first 6 months, I think. Once you take the core, patients will find you. It's a learning curve, and it's free for a year. Yeah, for when you first take the course. So all I can tell you, Anonymous, is buckle up, get ready for new business. It takes the plate, whatever you spend on equipment will take the price of your advertising costs, because every single pain patient that you fix knows 6 people just like them. And it is absolutely the most fun you're going to have in medicine. I don't care what kind of practitioners you are. Yeah, and we actually have a slide on that in the core. Julie, CRPS with Lyme. CRPS is CRPS, Lyme is Lyme. They're not caused by each other, although Lyme can create inflammation. So treat the CRPS. That is now covered in the neurovisceral module. And I watched that. Lyme disease is, once you've taken the neurovisceral module, then you will have access to our website and the advanced compendium, where we have specific workshops that have been presented by Neil Nathan, Roger Bellica, and Jessica. Why can't I remember her name? The one in New Jersey. And it'll come to me. Like, she just talked to her today. Anyway, yeah, both are treatable. FSM helps, makes it faster. Reviewed the 2018-19 core videos. Oh man, you've got to see the 5-day that's coming up. I'm just so giddy about it. It's what I should have done 20 years ago. Do look forward to the advance. It's going to be fun. Do I need a license in the US? You need a license just about everywhere to touch patients. So except in California, there's something called a certified health practitioner that requires no training at all, which is actually kind of terrifying. But you can get a massage therapy license in some states, and that'll allow you to treat some patients. That's kind of good if they allowed you to use electrical stim. Alex, can it be used to treat sarcopenia? It depends on how bad it is. You can treat the fractures, but the thing to do with sarcopenia is to look at the vitamin D levels. And if your vitamin D is below, I mean, the medical limit now is 30, thank God. But if it's below 50, you're going to be, vitamin D3, test the vitamin D. They'll have to pay for it because for reasons that escape me, the insurance companies have decided to stop paying for vitamin D and testing. So it's worth the 50 or 60 or 70 bucks to test it. If you live almost any place, even in the South, you're going to have low vitamin D levels. I've taken everything when I fractured my shoulder, fallen off a horse, fractured it into 6 pieces. My vitamin D levels are 30, but the research shows that that's going to drop. And so I took about 50,000 units a day for 5 weeks, and my vitamin D levels got up to 80, and that fracture healed. FSM for cataracts. I don't treat the eye. It's outside my scope. I don't have the training. I don't consider it to be safe. So cataract surgery, on the other hand, is piece of cake. Don't even hesitate. Find a good surgeon, somebody you get along with and you like, and have the cataract surgery. It was the coolest thing I ever did. It's magic. Little bit of Versed, you go to nap, or propofol, and you go to sleep for 60 minutes. You wake up later and you can see white is white and not yellow. Use the drops they tell you to drop, follow the directions, and it is magic. Bicom therapy. Okay, I don't know what Bicom therapy is, so I can't answer that part. We use it on horses. In the resonance effect, there's a great story about a Irish hunter that I treated that was just, oh my God, it's so fun. Horses get stoned when you treat racehorses for injuries. You treat them in the stall. You hook them up using wet towels as contacts, and they have to be near a wall because they kind of fall asleep. They don't ever go down, but they want to, so you have to watch it. They get stoned. It's pretty fun. Foot pain, plantar fasciitis, yes, depends on what causes it, but yeah, it's not that hard. Tarsal tunnel is actually covered in the, where did I put it? It's in the pain and injury protocol, or in the thing, the neurovisceral. I think it's in both. In tarsal tunnel, yeah, the nerve pain is easy.
Somewhere.
Carpal tunnel, yes, absolutely. Carpal tunnel surgery. Well, you don't want to get me started. Carpal tunnel surgery almost always involves problems in the neck as well as the wrist, but I haven't ever had one that I couldn't fix, except for one guy, and that's because his wife made him come in, and he already had the surgery scheduled, and he was didn't want to be there to begin with, but everybody else gets better. Uterine fibroids, yeah. Yes. Small fibroids, yes, you treat inflammation and fibrosis. Small fibroids, yes. Once they get 6, 7, 8 centimeters, they're too big. But sort of. Pulsed EMF therapy, FDA approved, decreases prone, blah, 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 blah. Well, everything's portable, Dennis. So FSM has a magnetic converter that turns the frequency-specific electrical pulses into frequency-specific magnetic pulses. Pulsed EMF, every moving magnetic field causes electrons to move, and when you move electrons, you increase ATP. So, yep, it's approved, but it's got good data, but it's not FSM. So I'd buy a custom care and a magnetic converter. FSM, Dennis, man, you like to get into trouble, don't you? FSM effective in cancer patients. We do not treat cancer with FSM, period, end of discussion. And if you're successful treating a cancer patient, I don't want to hear about it. I don't want it in print. I like living in the United States, and every successful alternative cancer therapy in the world, well, in the US, has been either put in jail, chased offshore to the Bahamas or Mexico. We use FSM as an adjunct in cancer. Roger Bellica has a workshop, an advanced workshop on that. We can treat the effects of chemotherapy and radiation. There are so many other things that we can treat with FSM. It's just silly to try and treat cancer with it, because in part, if I do something just out of ignorance and I make your pain worse, it's just pain, right? It's just pain. It affects the quality of your life, but it's not going to kill you. If I do something inadvertently through ignorance or inexperience and I make your cancer worse, you may not have time to get back on top of it. So we don't treat cancer. We keep cancer patients out of pain up until the day they have to go into the hospital when they're terminal. So that part we're really good at. Inflammatory bowel disease. Yeah, more or less, that's easy. Irritable bowel, Crohn's, ulcerative colitis, you have to fix the infection that caused it. All of those, we have specific cases in the neurovisceral workshop. I'd suggest you start with that one, given the kinds of questions you're asking, Dennis. Start with that one. Find a qualified FSM practitioner. Well, I teach them the language. I can't regulate what they say with it or what kind of a practitioner they are. So on our website, we have a practitioner list that is not quite ready yet, updated, accurate. We have a practitioner list on our website. Find a practitioner.
Yeah. just be better.
And it's improving. I think it's going to launch next week, but the one that we have there, then you find a list of practitioners that are near you, then you call them and go see them and call them and find out if they are willing to treat whatever it is you have. And then you go see them and see if it's a good fit. It's not a good fit. You think they're weird. They don't get it. You don't. If you're not 50% better in about 4 sessions, you need to hire somebody else. Yes, we have had pharmacists use this by hiring a doc or a massage therapist. Leaky gut, absolutely. Neurovisceral, the visceral section, David Musnick is a functional medicine faculty member. He teaches that visceral day for us. Leaky gut is, I hate to say it's a piece of cake, but it's really not that hard. What is that certification you mentioned in California that would allow people to practice FSM? Lance, I'm not going to tell you that because I think those people are, the ones we've had that have taken the course have been good. You can research that yourself, but you need medical training to be doing medical diagnoses. We treat some serious things with FSM. You need to know what you're doing. So you can treat yourself, but you just call the state of California and look it up. Trigeminal neuralgia, yes. We've used both electrodes and wet things, but you got to find out where it comes from. Mary Ellen Chalmers at next year's Advance is going to do a 90-minute workshop on facial pain that'll include trigeminal neuralgia, and we talk about it in the neurovisceral. Certification required. You got to have a license that allows, Julie, certification required to buy a precision care. You have to have a license that allows you to treat people, and the PDI compliance people are pretty careful about that now. So you tell them what your license is. We are not, and you sign a disclaimer that says you told us your license is as a physical therapist, occupational therapist, chiropractor, MD, DO, nurse practitioner, nurse, PhD, somebody that has a license to treat, to touch patients. And you put that down and you check the box that says, I take responsibility for this. And also, I agree not to treat people if I don't have a license. Cervical stenosis, yes, you can treat it. It helps with the pain. If you get really lucky, you can reduce the pain of the cervical stenosis. Whether or not we can actually reduce the stenosis, Dennis, I don't have any data on that. Diabetes, hypertension, good heavens. Gastroparesis, herniated discs. Okay. With FSM, so the last part, the gastroparesis, the asthma, the allergies, Epstein-Barr is usually opportunistic, but if Epstein-Barr is what started it, the infection turns off the vagus downregulation causes the allergy, the asthma, contributes to the type 2 diabetes, causes the gastroparesis, the herniated discs in the lumbar and cervical spine. Those can also be involved, just the pain. But the discs are easy as long as they're not compressing the spinal cord and your spinal cord's not at risk. The depression, anxiety, and insomnia are also related to the vagal dysfunction that we can fix. That would be also in the neurovisceral module. TBI, glaucoma, cataracts. Cataracts have surgery. Glaucoma, see your ophthalmologist. I don't do that. Traumatic brain injuries, how to begin integrating FSM technology treatments with others on the healthcare team. Well, first you get the basic stuff. Hope that the patient has physicians with whom you can communicate. And for example, if the whole thing started with a parasite they picked up on a trip to Washington, D.C. or India, then you get somebody on the healthcare team to treat the parasite, and then you can treat the rest of it. Age-related muscle loss, that I don't know, Anonymous. Age-related muscle loss is not usually age-related. It's because you're in pain and you don't want to move it. So, whoops. What happened to age-related? Did you erase that question? Oh, okay. Anyway, alopecia. In males, we have one case of alopecia was alopecia. It's an autoimmune condition, and we've had one case report of where a practitioner in Ireland got it turned around. I don't have any additional case reports, so I don't know. The fortunate thing is that the bald look is really pretty in right now, so that part's okay. Dennis, I'd start with the custom care. I think you're the one that said you're not licensed. Is that you? No, that was Lance. Anyway, if you have a license, depending on what kind of physician or practitioner you are, then I'd start with the custom care, see how it works. And then if you have more specific needs and you get more, you usually get, if you're a good medical practitioner, osteopath, chiropractor, naturopath, or a good manual therapist, physical therapist, chiropractor, occupational therapist that uses your hands, you'll need a precision care. But if you're a generalist, I'd start with the custom care and see at what point you get frustrated. Flexner report, that ain't going to change. That ship sailed. I wouldn't get your hopes up. So the way we have survived is by playing by the rules. Just the devices are one thing. I am a clinician sharing my clinical results with other clinicians. BPH protocol doesn't show much results. I'm so sorry to hear that. Is there an adjunct protocol? I would get a prostate massage myself and do the other things and the other supplements that you need to do to create a stable state for benign prostatic hypertrophy. So yeah, there's more that you can do. Dennis, you're licensed, yay. Well then, oh, veterinarian? Oh, dude, it still depends on how complicated your patients are. Custom care might be the easiest to start with because then you can hook them up, punch a button, leave the room. If you're treating large animals, cows, horses, race horses, jumpers, performance horses, sports horses, then I'd still start with the custom care because you can put that on a wrap and just hang it on the horse and have somebody hold him there. And if you're medically licensed, that's even easier. You have a defibrillator, yes. Use it above the collarbone, below the waist. Just don't use it across the chest. Oh, there's alopecia. Yeah, not reliably. Wow, cool. Well, that was really fun. I think we got through all 53 questions. Well, I had a great time. This is a great way to do this. And Kevin was right. I hate it when Kevin's right. But it's just easier to go through the material first, I think. Or maybe it's just that I like to hear myself talk. I hope your next step is to go to frequencyspecific.com. How do I get back to this? Is to go to frequencyspecific.com and come on. Thank you. There. Frequencyspecific.com and look for either one of the 3-day modules that were recorded. The ones that were recorded in July are an improvement. The 5-day course is coming up. It's going to be a handful, but it should be fun. Get the Resonance Effect if you haven't read it. Enjoy. And I will talk to you. I'm hoping I'll talk to you sometime soon. Have a great day. Do good things, and we'll talk to you later.